14 signs of poor circulation that could save your life if recognized in time. Have you ever felt your hands and feet tingle for no apparent reason? Or perhaps you've noticed that your skin is drier or your legs are more tired than usual. These could be signs that your blood circulation is not working as it should. Circulation is responsible for bringing oxygen and essential nutrients to all parts of the body. But when there are problems in this system, the body begins to give signals that should not be ignored. What can cause these problems? The factors are varied: sedentary lifestyle, poor diet, chronic diseases such as diabetes, or even stress. The important thing is to know how to recognize the signs and understand what your body is trying to communicate. In this video, we will explore the 14 most common signs of poor circulation. Additionally, you will discover how to improve the health of your circulatory system with practical tips and habit changes that can transform your quality of life. Let's get started. 1. Hot trim on hands and feet. Have you ever felt that uncomfortable tingling sensation in your hands and feet, as if little ants were crawling across your skin? This symptom, also known as paresthesia, can be a sign of poor blood circulation. Tingling occurs when blood flow is reduced or interrupted, preventing oxygen and nutrients from reaching the body's extremities properly. In many cases, this is related to pressure placed on nerves or blood vessels due to tight clothing, poor posture, or even a sedentary lifestyle. But what if the symptom persists? Constant or frequent tingling may indicate more serious conditions, such as peripheral neuropathy, which is very common in people with diabetes. Excess glucose in the blood can damage vessels and nerves, further aggravating the problem. Other causes include diseases such as venous insufficiency, which makes it difficult for blood to return to the heart, and cardiovascular problems that compromise circulation in general. What to do? If you experience frequent episodes of tingling, the first step is to see a doctor to investigate the underlying causes. In the meantime, adopting some practices can help. Avoid tight clothing, stay hydrated, and move regularly. Short walks throughout the day are an excellent way to activate circulation and alleviate the symptom. Don't ignore the tingling, as it may be the first warning that something is not working well in your body. Remember, prevention is always the best way. 2. Cold hands and feet. Feeling cold hands and feet on a winter day may seem normal, but what happens when it happens at any time of year? This is a classic sign of poor circulation that deserves attention. When blood does not reach the body's extremities properly, the temperature in these areas tends to drop. The circulatory system, which is also responsible for maintaining stable body temperature, faces difficulties in distributing heat evenly. One of the conditions that can cause cold hands and feet is Raynaud's disease. This rare condition causes temporary narrowing of the arteries, reducing blood flow. In affected people, hands and feet not only feel cold, but may also turn pale or bluish during attacks. Additionally, poor circulation associated with other conditions such as high blood pressure, high cholesterol, or heart disease can make blood transport even more difficult. What to do? Start noticing when and how often this happens. If the symptom is persistent, it is important to seek medical advice. Regular physical exercise, such as walking or yoga, can help stimulate blood flow. Keeping the body warm and avoiding prolonged exposure to cold are also useful measures. Remember, cold hands and feet may seem harmless, but they are a reflection of how well your circulatory system is working. Detecting and treating the problem early can make all the difference in avoiding further complications in the future. 3. Dry skin. Do you hydrate your skin regularly, drink plenty of water, but it remains dry and rough? Although many associate dry skin solely with external factors, such as the weather or lack of hydration, it can also be a sign of poor blood circulation. When blood flow is compromised, the body prioritizes sending nutrients and oxygen to vital organs, leaving the skin in second place. Without adequate irrigation, the skin begins to lose its elasticity and natural shine, becoming dry and even scaly. Poor circulation can reduce the body's ability to eliminate toxins. This accumulation of waste can harm the health of the skin, making it more vulnerable to irritation and infections. Furthermore, circulatory problems can directly affect collagen production, essential for keeping skin healthy and young. What to do? If you notice that your skin is constantly dry, even with the usual care, it is important to investigate possible circulation problems. Practicing physical activities such as walking or cycling can stimulate blood flow and improve skin health. Additionally, including foods rich in omega-3 and antioxidants in your diet can help nourish your skin from the inside out. Don't underestimate the signs your skin is giving you. It can be the mirror of what is happening internally in your body. Taking care of your circulation not only benefits your overall health, but also restores vitality to your appearance. 4. Swelling in the feet. Have you ever noticed that your feet, ankles, or even calves feel swollen at the end of the day? This swelling, known as edema, can be one of the most obvious signs of poor blood circulation. When the circulatory system does not work efficiently, blood and body fluids can accumulate in the lower extremities. This fluid retention is especially common in people who spend long periods sitting or standing, making it difficult for blood to return to the heart. Edema can also be caused by more serious conditions, such as venous insufficiency, hypertension, heart or kidney problems. In these cases, swelling may be accompanied by other symptoms, such as pain, stiffness, a feeling of heaviness in the legs, and shiny or tight skin. In pregnant women, excessive swelling can be a warning for conditions such as preeclampsia, requiring immediate medical attention. What to do? The first step is to observe when the swelling occurs and how long it lasts. Keeping your legs elevated for a few minutes throughout the day can help reduce fluid buildup. The use of compression socks may also be recommended, as they help return blood to the heart. However, if the swelling is constant or severe, it is essential to consult a doctor to investigate the cause and avoid complications. Remember, treating edema is treating the root of the problem. Do not ignore these signs, as they can be the initial warning of conditions that, if left untreated, can seriously affect your health. 5. Changes in skin color. Have you ever noticed that some parts of your body become paler, bluish, or even purplish? These changes in skin color may indicate serious blood circulation problems. When blood does not flow properly, sufficient oxygen does not reach certain areas of the body. As a result, these regions may have a different color, generally colder to the touch and without vitality. The extremities, such as hands, feet, fingers, and even lips, are the most frequently affected areas. Paleness may be a sign of temporary reduction in blood flow, while a bluish hue, known as cyanosis, indicates low oxygen levels in the blood. In extreme cases, these changes may be associated with conditions such as heart or arterial failure, thrombosis, or vascular diseases, such as Raynaud's syndrome. What to do? If you notice changes in skin color that do not disappear quickly, it is essential to seek medical advice. Furthermore, keeping the body active is essential to stimulate circulation. Daily walks, stretching, and low-impact exercises, such as swimming, help improve blood flow and prevent the problem from worsening. Avoiding wearing tight clothing and keeping your body warm, especially in cold weather, can also help minimize these symptoms. Remember, skin color is a direct reflection of the health of the circulatory system. Don't ignore these changes, as they can be a clear sign that your body needs immediate attention. 6. Memory and concentration problems. Have you ever found yourself forgetting simple things or having trouble concentrating? Although we often attribute these symptoms to stress or tiredness, they can also be related to blood circulation problems. The brain is one of the organs that consumes the most oxygen and nutrients in the body. Around 15% of blood flow is directed to it, ensuring it functions fully. When circulation is compromised, the amount of oxygen reaching the brain decreases, directly affecting its ability to work efficiently. This deficit in the supply of oxygen and nutrients can cause mental confusion, difficulty making decisions, memory lapses, and even a feeling of slowness in thoughts. If left untreated, the problem can worsen, leading to more serious conditions such as ischemia or stroke. What to do? Improving circulation to the brain starts with lifestyle changes. Practicing physical exercise, such as walking or cycling, helps increase blood flow. Additionally, including foods rich in omega-3, such as fish and seeds, can improve brain health and strengthen blood vessels. Avoiding harmful habits, such as smoking or drinking excessive alcohol, is equally important to preserve the health of the circulatory system. If these symptoms persist, see a doctor. Simple tests can identify changes in circulation and allow early interventions. Remember, keeping your brain active, whether through mental or physical exercises, is essential to ensure that it functions well at all stages of life. 7. Dizziness and headache. Experiencing frequent dizziness or persistent headaches can be more than just a symptom of tiredness. These signs may indicate circulatory problems that directly affect blood flow to the brain. When blood does not reach the brain in sufficient quantity, the oxygen necessary for its functions is also reduced. This lack of oxygenation can cause dizziness, a feeling of imbalance, and headaches. In more serious cases, it can lead to fainting or momentary loss of consciousness. Poor circulation may be related to blockages in the blood vessels, such as fatty deposits or clots. These obstructions not only restrict blood flow, but can also increase the risk of serious events such as stroke. If, in addition to headaches and dizziness, you notice symptoms such as blurred vision, difficulty speaking, or coordinating movements, seek medical help immediately. These could be signs of a serious circulatory problem that requires urgent attention. What to do? Simple practices, such as staying hydrated and avoiding long periods without moving, can help alleviate these symptoms. Adopting a balanced diet, rich in vegetables, fruits, and healthy fats, is also essential to protect blood vessels. Furthermore, including physical activities in your routine, such as walking or aerobic exercise, improves circulation and reduces the risk of complications. If dizziness or headaches persist, see a doctor for an accurate diagnosis. Don't underestimate these signs. They can be a warning from the body, indicating that your circulation needs immediate attention and care. 8. Lack of appetite and digestive problems. Have you ever lost your appetite without explanation or experienced frequent digestive discomfort, such as gas or bloating? Although they are often ignored, these symptoms may be related to poor blood circulation. The digestive system depends on a constant flow of blood to function properly. When there are circulatory problems, blood is not distributed effectively to the gastrointestinal tract, impairing digestion. As a result, metabolism slows down, causing a feeling of heaviness, difficulty digesting food, and even loss of appetite. Additionally, poor circulation can interfere with the absorption of essential nutrients. This occurs because the transport of these elements through the blood is compromised, which can lead to malnutrition, even in people who maintain an apparently balanced diet. This type of problem can also worsen in conditions such as heart failure or diabetes, which directly affect blood flow. What to do? If you notice that loss of appetite or digestive discomforts are frequent, it is important to consult a doctor. Eating a diet rich in fiber, vegetables, and foods that promote circulation, such as oranges and chia seeds, can help alleviate symptoms. Practicing regular physical exercise is essential, as it stimulates blood flow to the digestive system. Furthermore, drinking enough water throughout the day helps the intestinal tract function. Digestive health is a reflection of the functioning of the body as a whole. Don't ignore these signs, as they may indicate that your circulatory system needs care. 9. Weakened immune system. Are you getting sick more often than usual? Recurring colds, persistent infections, or difficulty recovering can be a sign that something is not right with your blood circulation. The immune system directly depends on blood flow to function effectively. Blood is responsible for transporting defense cells, nutrients, and vitamins to fight viruses, bacteria, and toxins. When blood flow is slow or insufficient, the body loses its ability to respond quickly, leaving it more vulnerable. Furthermore, impaired circulation makes it difficult to eliminate waste and toxins, which can accumulate in the body and worsen immune weakening. This can accelerate inflammatory processes, impair cell regeneration, and even contribute to premature aging. What to do? Strengthening the immune system begins with taking care of the circulatory system. Include foods rich in vitamin C, such as citrus fruits, and antioxidants, present in green leafy vegetables in your diet. Furthermore, consuming omega-3, found in fish and seeds, helps reduce inflammation and improve circulation. Practicing physical activity regularly is also essential, as movement stimulates blood flow and strengthens the immune defense. Avoiding harmful habits, such as smoking or drinking excessive alcohol, is essential to protect the heart and circulatory system. If you notice that your body is more vulnerable, don't ignore it. Seek medical advice and take care of your circulatory system to restore your body's vitality. 10. Joint pain and muscle cramps. Do you feel frequent joint pain or suffer from muscle cramps, especially at night? These symptoms may be related to poor blood circulation, which directly affects the functioning of muscles and joints. Adequate circulation is essential to deliver oxygen and nutrients to muscle tissues. When blood flow is insufficient, muscles do not receive the energy they need, leading to the buildup of lactic acid, which causes cramping and stiffness. Furthermore, a lack of irrigation can harm joints, causing pain and inflammation, especially in the extremities of the body. These problems are especially common in people who spend long periods of time sitting or standing, or who have conditions such as venous insufficiency, arthritis, or diabetes. In more serious cases, poor circulation can make it difficult to recover from even minor muscle or joint injuries, worsening symptoms. What to do? To alleviate these symptoms, it is important to adopt habits that improve circulation. Regular walking and stretching exercises help keep your blood flowing and reduce muscle stiffness. Wearing compression stockings can also be an effective solution, especially for those who spend a lot of time in the same position. Staying hydrated and consuming foods rich in potassium, such as bananas and potatoes, can help prevent cramps. On the other hand, avoid excessive salt consumption, which can contribute to fluid retention and worsen symptoms. If pain and cramps persist, see a doctor to evaluate your circulation and rule out more serious problems. Remember, recurring pain should never be ignored, as it is a sign that something needs attention in your body. 11. There is no libido. Have you ever noticed a decrease in sexual desire without an apparent cause? This situation can be uncomfortable and often ignored, but it can be linked to poor blood circulation. Circulation plays an essential role in sexual health. In the case of men, inadequate blood flow can lead to difficulty maintaining an erection, while in women, it can reduce sensitivity and lubrication. This happens because blood is responsible for bringing oxygen and nutrients to the genitals, which are essential for the healthy functioning of the reproductive system. Furthermore, poor circulation can interfere with hormone production. Hormones such as testosterone, which have a direct role in libido, depend on an efficient circulatory system to be distributed correctly in the body. When this process is compromised, sexual desire can decrease significantly. What to do? Improving the health of the circulatory system is the first step to restoring libido. Adopting a balanced diet, rich in foods that promote circulation, such as fish rich in omega-3, red fruits and nuts, can help. Practicing physical exercise is also essential, as it improves blood flow and reduces stress, which often aggravates the problem. Avoiding harmful habits, such as smoking and excessive alcohol consumption, is also important, as these substances compromise the vascular system and hormonal production. If the drop in libido persists, do not hesitate to seek medical help. Circulation problems can be treated, and taking care of this aspect is essential not only for sexual health, but for general well-being. 12. Varicose veins. Have you ever noticed bulging or dilated veins on your legs, known as varicose veins? Although many people consider them an aesthetic problem, varicose veins are a clear sign of poor venous circulation and may indicate a more serious problem. Veins have the function of transporting blood back to the heart, and this becomes a special challenge in the legs, where the blood needs to overcome gravity. When the valves in the veins do not work properly, blood begins to accumulate, causing dilation of the veins and, consequently, varicose veins. At first, they may appear as small purplish lines or vascular spiders. Over time, they can develop into bulging veins, which in addition to being painful, can cause a feeling of heaviness, swelling, and even itching in the legs. If left untreated, varicose veins can lead to serious complications, such as venous ulcers and thrombosis. What to do? To prevent or alleviate the symptoms of varicose veins, staying active is essential. Exercises such as walking, swimming, or cycling help to stimulate blood flow in the legs. Avoiding sitting or standing in the same position for a long time is also essential to prevent the problem from worsening. Wearing compression stockings can be a practical solution to reduce discomfort and improve circulation. Additionally, Elevating your legs at the end of the day helps blood return to the heart more easily. If you already notice larger varicose veins or feel constant discomfort, see an angiologist or vascular surgeon. Taking care of your venous health not only improves the aesthetics of your legs, but also prevents complications that can compromise your quality of life. 13. Chest pain. Angina. Have you ever felt pain in your chest when performing physical activities, or even when resting? This sensation can be a warning sign called angina, indicating that the heart is not receiving enough blood to meet the body's demands. Angina occurs when the coronary arteries, responsible for delivering blood to the heart muscle, are partially blocked. This condition can be caused by the accumulation of fatty plaques, atherosclerosis, or clots, which hinder blood flow. The pain is usually described as pressure or tightness in the chest, but it can also radiate to the arms, shoulders, neck, or jaw. Although angina is not a heart attack, it is a strong indication that the heart is overloaded and at risk of suffering more serious complications. Ignoring this symptom can lead to problems like heart failure or heart attack that require urgent treatment. What to do? If you experience chest pain for the first time, especially after physical exertion, seek medical attention immediately. Resting may temporarily relieve pain, but it is essential to identify the underlying cause and treat it appropriately. Adopting a balanced diet, rich in foods that help reduce cholesterol and strengthen the heart, is an important step. Include foods like avocado, olive oil, and fish rich in omega-3. Additionally, practice regular physical and avoid habits such as smoking, which aggravate heart conditions. Angina is a sign that your heart is crying out for help. By taking care of your circulation, you not only protect your heart, but also improve your overall health. 14. Constant fatigue. Do you feel persistent tiredness, even after a good night's sleep? Constant fatigue can be one of the first signs of poor blood circulation, directly affecting your energy and ability to carry out everyday activities. When blood does not flow properly, the supply of oxygen and nutrients to muscles and organs is reduced. This lack of energy causes the body to work slower and less efficiently, resulting in a continuous feeling of exhaustion. The heart, when trying to compensate for insufficient blood flow, has to pump harder, which consumes even more energy. Furthermore, the accumulation of toxins in the muscles, caused by poor circulation, makes recovery after physical exertion difficult, intensifying the feeling of tiredness. Fatigue may be related to conditions such as anemia, heart failure, or metabolic problems, which affect the blood's ability to transport oxygen and nutrients. What to do? If constant tiredness is part of your routine, it is important to investigate possible underlying causes with a healthcare professional. Meanwhile, practices such as maintaining a balanced diet, rich in iron and B vitamins, can help improve energy levels. Light exercise, such as walking or stretching, is effective in stimulating circulation and reducing the buildup of toxins in the muscles. Avoiding harmful habits such as excessive alcohol and tobacco consumption is also essential to optimize the health of the circulatory system. Fatigue may seem like a simple symptom, but it's a reflection that your body is overworked. Treat this sign as a cry for help from your body and take the necessary measures to restore your energy and vitality. What to do to improve circulation? Improving blood circulation is a task that requires consistent lifestyle changes. Although treatment depends on the underlying causes, some universal practices can help promote healthy blood flow and prevent complications. First, it is essential to adopt a balanced diet. Consume foods rich in omega-3, such as salmon and flax seeds, which help reduce bad cholesterol and improve blood vessel health. Include citrus fruits, such as orange and lemon, which contain vitamin C, essential for strengthening vessel walls. Avoid processed foods, rich in sodium and sugar, which can worsen circulatory problems. Practicing physical exercise is another fundamental pillar. Aerobic activities such as walking, swimming, and cycling help increase your heart rate and improve blood flow. Even simple exercises like climbing stairs or stretching regularly can make a big difference. Avoiding harmful habits is also crucial. Smoking and excessive alcohol consumption are major enemies of the circulatory system, as they damage blood vessels and increase the risk of cardiovascular disease. Another important point is stress control. High levels of stress can constrict blood vessels and raise blood pressure, impairing circulation. Relaxation techniques such as meditation and deep breathing can help reduce the impact of stress on the body. Furthermore, staying hydrated is essential. Water helps keep blood fluid, making it easier to transport throughout the body. Combine this with a good night's sleep, which allows the body to recover and function more efficiently. Finally, don't ignore your body's signals. If you notice persistent symptoms of poor circulation, such as pain, swelling, or excessive tiredness, see a doctor. Simple tests can identify problems and ensure you receive the appropriate treatment to improve your health. Remember, taking care of your circulation is an investment in your quality of life. Taking care of your circulation is more than a matter of physical health. It's an act of self-love and an investment in your future. Your body is an incredible machine, and keeping your circulatory system fully functioning is essential to living with more energy, vitality, and well-being. Remember, the small signals that the body gives should not be ignored. Every adjustment you make today, whether in your diet, exercising, or combating harmful habits, can make a huge difference in your quality of life. Be proactive about your health. Consult professionals, follow guidelines, and take measures to preserve the ideal functioning of your body. By adopting a healthier lifestyle, you not only improve your circulation, but you also protect your heart, brain, and entire body. Life is more vibrant when lived to the full. Do not wait for symptoms to worsen before taking action. Take care of yourself, inspire others to do the same, and allow your body to work for you. Remember, your well-being depends on the choices you make today.